Hello, for the presentation of Samiki, my project is analysis of the relationship between empathy and the hospitality values in nursing students. I'm Helena Lomba de Oliveira, advised by the Professora Marisa Inês Corradi. Empathy is a complex and multidimensional concept constituted by the moral, cognitive, emotional, and behavioral dimensions. Being empathic involves understanding the feelings of others by the ability of putting themselves in their place, which is very important in the health sector because empathy becomes a valuable instrument of the humanization of care since it starts to be configured in personal values and in the understanding of the true meaning of care. The hospitality can be understood as one of the expressions of health and nursing care and perceived as a set of qualified, humanized, and welcoming characteristics. The welcoming as a participant of the hospitality is realized in serving the other, perceiving the differences. So, humanization of care occurs through adequate assistance in the welcoming environment. The objective was to analyze the factors that may influence the type and level of empathy of nursing students and how this may be related to their estimative of professionals and ethical values. This study is part of the project Analysis of Relationship between Empathy and Hospitality Values in the context of the humanization of assistance, approved by the Research Ethics Committee. 113 students from a private higher education institution in Curitiba were interviewed. However, four forms were excluded from the research. This was the instrument for the empathy and this one for the hospitality. In the results was possible to establish a correlation between the scales of empathy and hospitality. For example, the empathic consideration with the transpersonal care has a strong and significant correlation. And the feelings and behaviors that contribute to empathic attitudes do not depend on sex in this sample, and the students show importance for the values that contribute to hospitality. So, by these correlations, was being an indicator that hospitality can be influenced by feelings that promote empathy, and that the greater the feeling of empathy, the greater the opening for reception. This study allowed a greater understanding about the full-time and humanized nursing care to the patient and how academic training can contribute so that the necessary values for this assistance are improved and developed. Thank you.